Hi there, it's KMC coming to you with this Help Desk episode on our continuing track of talking about how you can keep more cash by keeping more patients. And today I thought I would speak just a little bit about the conversion to wellness or maintenance care. We know that at the end of an active episode of treatment, several things can happen. That episode is closed out, a pin put in it with the discharge. The patient's episode is closed. We tell them something, and doctors, that largely depends on your philosophy, what you do, how you practice. Could be that you're telling the patient to return for maintenance care, whatever that definition is for you, or wellness care, or PRN care, meaning come back when you need it. Most of the time, we do some of that. One of those things is very, very common in practice. So I want to focus in on the transition from active treatment into maintenance or wellness care and that conversation of how patients stay in your practice community. And by staying in your practice community, they stay as a part of that practice family and they receive the care they need, whether it's active or maintenance care. So first and foremost, when we think about transitioning into one of these types of care, we cannot assume that the first time the patient hears about it is actually when it's time to do that transition. That needs to begin very, very early in the process, perhaps even at your report of findings, maybe even the initial visit when you talk about the way that care is provided in your practice. Office workers, CAs, also need to understand this process as they're talking to patient, the table talk for your back office CAs, the front desk or the insurance workers and how they talk to patients about the financial side of this conversation. Because generally most patients will not have maintenance coverage. Very interesting. I was recently in an on-site visit, and there were 3 insurance companies in their state that pay for maintenance care at a prescribed rate. So we can't say it's never covered anymore. But assuming that most maintenance care is going to be out of pocket and cash pay, it's important that the patient get this conversation a little bit along the way. At that first reevaluation, doctors, you're talking about their progress so far and why they need more care if they do. As you're progressing them through different therapies or different treatments, now it's time to start talking about how they're progressing and then how you may want them to maintain that. So we're sprinkling just a little bit across the board. Now, when it does come time for that transition, and let's think about Medicare perhaps just a little bit differently, but the conversation will usually go something like this. Mrs. Jones, congratulations. We've reached that point that we talked about. And at this point, we're going to discharge you from active treatment on the active episode of care that we were working with. At this point, my best recommendation is, and that's whatever that recommendation is, just return when you need to, or something that's a little bit more of a maintenance or wellness schedule. And let's assume that this doctor is once a month is what they're recommending. I'd like to see you again in a month. Let's confirm that everything is holding the way that I expect it to. And at that point, your insurance company expects you to cover those costs, and we can talk all about what that would look like. But what I'd love is for you to not go back to how you were when I first saw you 2 months ago. Let's make sure that you can stay with your head above water and be able to control that pain and that suffering that you had. And then we have a financial conversation about it. What does that look like in your practice for self-pay maintenance care? Is that something, perhaps you're a member of ChiroHealth USA and you've got a maintenance fee schedule? Maybe it is your actual fee. That's okay too. And when we are talking about that with Medicare, of course, the next step is that at that point, you do not get an ABN form signed until the patient returns. And the first visit of maintenance, because it has to be confirmed it's maintenance, is when that ABN form is signed. And then, of course, you have on that ABN form what your fees look like. It has been my experience over more than 4 decades in this profession that when we think of patients as a practice community, not forcing them to come back or any of that head talk that we do sometimes, but just really making your very best recommendations and then letting patients kind of make their own choices, we have the most healthy practices that way. And I hope that you think about how you might begin to educate your patients a little bit differently, help to have those conversations about maintenance and wellness care. And by keeping them in your practice family, so much easier when they do have a flare-up, come right back and they are right back into another active episode of care. I hope this works for you. And I'd love you to like and subscribe, and let's hear about your details and your feelings on this. We'd love to get the conversation going. Here's to keeping more patients so you can keep more cash.